Just a large one. Use your arms down, probably a lot of blood flow. You don't want positive feedback. Right.
We kind of already discussed it, but yeah. Positive would be even more detrimental.
Yeah. Okay, so hopefully, if you're looking at that information and going back and thinking, because one of the things that we're going to see, you're going to hopefully see as a theme for both A&P 1 and 2 is this negative feedback, okay? So if we think about it, negative feedback, what's your thoughts on it? Does it help? Is it hurtful? Is it
It's positive. It continues.
it's positive, okay? And so positive feedback is the negative one, okay? So now, if we move forward, terminology body plan. This is something in your textbook, you have Atlas A. This will be, can't remember in the ebook if they put it at the beginning, when you're looking at the table of contents on the ebook, just click on the Atlas A, because Atlas A it's beginning to get you oriented to terminology you're going to see in the workplace, that you're going to see in any courses you move forward into. Because when we talk about the terminology for the medical profession, dealing with the human body, one thing very important, what is anatomical position? If you think about our body position, like for example, as we're walking, our hands are kind of this way, all right? We're kind of walking like this, okay? However, proper anatomical position is this. So, you're probably thinking, when am I ever going to use this? You will use this every day, okay? Especially if you're going into radiation, okay? Those terms are going to all over the place. Now, anatomical position, all right? Body erect, face forward, feet together, palms face forward. Not like this, like we usually stand. If the body is in a lying position, okay, and you got to think about have you ever heard those terms used, like the supine and the prone? Have you ever watched any like medical shows, crime shows, or whatever? You will hear people, for example, say the body was found in the supine position, or the body was found in the prone position. This is letting whoever's listening or whoever may be reading the report know in the direction the body might have been found. When you have a patient, and the patient may be needing to get transported, or they may need to have, they're having a procedure done, they will say the body is in the supine position, the body is in the prone position. Okay? So supine, face upward, prone, face downward. So either like this or like that. Okay? Then, not only do we have to worry about which way the body might be positioned, what's the direction of it? Oh, goodness. What I can tell you, try to begin using the terms now. Okay? Think about them as you might be watching TV or reading a book or something like that. We have to see that there are some terms that come along with the explanations. We have cephalic, meaning head, okay? Caudal, meaning tail. Superior, higher up, inferior, lower. We have our proximal direction. Proximal means closer to the torso. Distal, further away from the torso. This applies to all limbs of the body. For example, if we look at the knee, okay, the knee is proximal to the ankle, okay, but if we compare it to another part of the body, it might be proximal. Does that make sense? If we have, all right, let's use the ankle, okay? The ankle is proximal to the toes, but the ankle is distal to the knee. All right? And these terms you will encounter, okay? For example, physical therapy, working in orthopedics. If you're in an ER, somebody presents with a broken bone, okay? You will see these terms. These terms are important. We need to understand when they say that something was medial. Medial means the midline of the body. Lateral means away. Like, for example, anybody in here ever had knee problems? Okay. Did you have to have surgery? No? But have you heard of people having knee problems? Or, for example, ACL? Anybody know what ACL stands for?
Anterior collateral ligament.
Okay, so they're telling us quite a few pieces of information. Anterior, letting you know a position. All right, someone who may have torn cartilage in their knee. They might have torn the medial meniscus. They may have torn the lateral meniscus. All right, so this is letting you know which side that particular damage is found. So these terms they're extremely important. When you have to say, for example, Read a patient's report. The doctors will, they will either do that typing that they do now when you go in to see them, or they may sit down and dictate, someone else types it. When you come back and you read that report, you'll see these terms being used. You'll get very used to them as you move forward in your other classes. Now, for anatomical position, but facing a different direction, letting us know anterior, posterior. Anterior is also known as ventral. Ventral refers to the heart, okay? Looking at the thoracic region, okay? Dorsal, have you ever heard of a dorsal fin on a fish? Okay, and that's on the back, okay? So they call it dorsal for posterior. Once again, superior, inferior, proximal, distal. When we begin to see some of these directional terms, this is a list right here that you can refer to. It's letting you know all of those terms that we just looked at. It's giving you the definition, and then it's giving you some examples. So you can come back and you can kind of read over this, and you can get some ideas on how to use these terms. And like I said, one of the things that I would suggest, just begin to use them now. As we work in lab, just kind of talk about them with your lab partner.
Do you think it would be easier for us to make flashcards for these?
Yes. Well, if that's a way that studies well for you, okay? For me, one of the ways I study well is like I would take this list and I would put that term, I'd put the definition, I'd put the example. I would make like it end up on a piece of paper looking like a chart, okay? But do you know why it's important to write? We retain information. Do you know why? If you are using skeletal muscle, and we'll learn skeletal muscle connected to a nerve. Nerves, of course, part of the nervous system. The brain is following that. There's one other thing that can help in learning, other than writing. The color you write with. Do you happen to know what color, and believe it or not, a lot of people say it's negative, but it's not. Do you know what color is the most effective? Red. The reason for that, our eyes can pick up 2 different colors for red. It's the only color we do that for. So it's much more pronounced. So you should, I mean, like when I was doing my classes and going through college, yes, oh my goodness, the tons of paper and the red ink pens I went through, okay? But it works. I was amazed at how well it worked. So become familiar with your terminology. Because say, for example, test time. If I were to take some of these terms and maybe create a matching for them, I would want you to be able to complete that matching based on information from here. Does that make sense? Okay. The terminology that we have, well, in the medical field.